Hello, everyone. Dr. Conrad here, and I'd like to welcome everyone to the Acute Care class, Lesson 3, and I've been really looking forward to this particular lesson. We got a lot of exciting material to cover, and the outline is as follows. We're going to talk about the repertory, case analysis, how to take a remedy, antidotes, potency, gastrointestinal tract problems. We'll do a review of cases, and we'll talk a little bit about Materia Medica and post-traumatic stress disorder. I hope that many of you have tried to use some of the information that you learned from Lesson 3. I had some success in battling colds and flus in my household. My wife developed some early flu symptoms, and I gave her a ferrum phosphoricum, which worked really well. It was a slow onset, sore throat, fever. And I developed the same symptoms a few days later, which helped. And that night, I developed an extremely high fever, woke up about 3 a.m. And for some reason, I had a craving of lemonade and something sour. And that was very, very characteristic of belladonna. When I took the belladonna, that kind of knocked the fever, took care of the fever, and I felt much better and slept. I do have a little lingering cough, and the spongia, I'm taking spongia, which seems to help. But anyway, in the course of 2 to 3 days, the homeopathic remedies really helped take care of my cold. And one thing I wanted to share with you is that when you are treating a cold or flu, you really have to be on top of it. You have to be changing remedies almost constantly, watching the body, listening to the body, observing symptoms. So in many cases of the flu, you're just not sticking with one particular remedy. So once again, if you do have any questions, you can raise your hand or you can type your question in the question block. I'll try to be observant for questions. So I thought what I would like to start with is to review the quiz. And I think these quizzes can be extremely beneficial, not only for you, but especially for me, because depending on your answers, I know if I've done a good job teaching. But one of you made the comment that essentially all of the answers were found on your slides. So just by reviewing the slides in your case notes, all the material was there, but some of the questions were a little tricky, and I'll go over them. So, number one, the physician, pharmacist, and scientist who discovered the medical discipline of homeopathy 200 years ago, and that, of course, is B. Samuel Hahnemann. Match the following: homeopathy, isopathy, allopathy. Well, we know that homeopathy is the same suffering. Isopathy is, homeopathy is like suffering. Isopathy is the same or identical. Allopathy is the opposite or the other. Constance Herring is credited with formulating the ideas of direction of cure. This means that cure proceeds, and this is Herring's law, which is important to understand in homeopathy. A, from above downward, that's true. From within outward, that's also true. From the most important to the least important, that's also true. And in the reversed order of the appearance of symptoms, and that's also true. So the answer for 3 is all of the above. Okay, now let's look at The type of pain associated with cantharis is extreme coldness. No, that's really not a characteristic of cantharis. Severe burning, yes, and that's the one that really sticks out when you think of cantharis, always associated with severe burning, and that's the answer. Puncture wounds, insect bites, better cold applications, black eye, which remedy is most indicated? Urtica urens, no. Heap or sulfuricum, no. Sarsaparilla, no. The answer is D, ledum, a big remedy for puncture wounds, insect bites. Match the following. A broken bone. The big remedy for that is synphytum, number one homeopathic remedy for synphytum. In fact, it's even suggested that if you do have a broken bone and it's not set properly, do not give synphytum. Synphytum can cause a bone to heal in an irregular manner. So if you do have a compound fracture and it's dislocated, make sure that the bone is first set before you give synphytum. Hives, urtica urens is the big remedy for hives. Nerve damage, C, especially small peripheral nerves, is hypericum. And sinusitis, especially when there's yellow pus, is Hepar sulfuricum. Now, many of you got this one wrong because a lot of times when you have a multiple choice question, some of the items are true, but they really don't pertain to the question. So according to Hahnemann, the purpose of homeopathic treatment, and this is in aphorism number 1, is not to suppress symptoms. It's not to remove obstacles to cure. Of course, removing obstacle cures are important, but that's not the purpose of homeopathy. The purpose of homeopathy is to cure in the safest, most gentle, permanent fashion. Number C. And of course, balancing the body pH is important, but that's not the purpose the layout of the Materia Medica. You need to read about the different remedies for each symptom. And this helps to expand your knowledge of homeopathy. Using the repertory takes practice, difficult, tedious, and time-consuming. And when I was studying homeopathy, I would carry Kent's repertory around with me constantly. When I was in the bathroom, I would open up the book and be reading different chapters. And I would make a game out of it. Anytime I heard somebody with a symptom, I would open up the repertory and, try to find that particular symptom. And the real benefit of using the repertory, you find these gems in the Materia Medica that you would never find if you did not read the book. I'm not saying to read the book cover to cover, but when you're looking at a particular symptom, and we'll go over some exercises, you want to kind of discover the other similar symptoms that are there, and you want to look at each symptom and see the whole family of remedies that are there. So the repertory helps you learn Materia Medica. But it is difficult and tedious. Most homeopathic students don't want to use the repertory. They just want a shortcut. But the repertory is a lifelong study. And the amount of time you put in, it will be very, very beneficial for you in the long term. So let's look at Kent's repertory. It was written in 1877. It combined many repertories. And what Kent did was he worked from general to specific, and it was based on anatomical divisions. Each section is in alphabetical order, and each main heading is followed by a modifier. And there's also a word index in the back of the repertory. So the layout of the repertory, he begins with general symptoms, sidedness. By sidedness is left or right, and also time modalities, morning, afternoon, evening, and night. Extensions, extending to the arm, the shoulder, the back of the head. Locations, descriptors or sensation. So when we talk about pain, there can be stabbing pain, jabbing pain, burning pain, aching pain, dull pain, etc. So the acronym to remember is Saint Meld, STMELD. ST is sidedness and time. MELD is modality, extension, locations, descriptors. There are 31 separate sections in Kent. Begins from the top of the body, the head, down to the bottom, and it's sorted by the first word of the rubric. So, for example, love, ailments from disappointed. So, look at hid pain. So, I wonder if you could, if you don't mind, I hope you have your repertory with you, and I want you to open up your book under hid pain. Okay, hid pain. I'm on page 132. The first thing that you notice is, as I mentioned, pain, headache in general. So remember, we started out with the general features first, and then we do the time. So we have morning, forenoon, which is between 10 and 12, afternoon, 1 to 6, evening, and night. And you can see on page 134, there's a breakdown in specific time abnormalities. So, for example, pain afternoon, hurting all night. There's 1 p.m., 1 to 3 p.m., 1 to 5 p.m., 1 to 10, etc. So those are the time modalities. Now, I do have to comment that the time modalities are important, and sometimes they can lead to a specific keynote. If you look at head pain, 3 p.m. is belladonna, and it's also 4 p.m. to 3 a.m. belladonna. So when you see the bold lettering, that is a very, very characteristic. So when I had my fever at 3 a.m., that was characteristic of belladonna. If you look on page 135, we have some aggravating modalities. So head pain, acids after. This means that someone who gets a headache after eating grapefruit or some type of acidic fruit. Ameliorate means ameliorate or makes it better. Now, the important thing to remember is that if ameliorate is not there, then you assume that it is worse. So a lot of times the repertory is, set up, such as head pain acids or head pain bending, head pain bed. So if there's no word amelioration mentioned, then you can assume that it's aggravation. In many locations of the repertory, they'll have aggravation and amelioration. So this is really important to define your homeopathic remedy in more detail. One thing that you'll learn in homeopathy, that a general or common symptom really doesn't lead you to the remedy. So if someone tells you, I have a headache, there's probably a couple thousand homeopathic remedies that match a headache. But when they tell you that the headache is more prominent at 3 o'clock and it's worse by bending forward, and it's worse by eating acidic food, then my goodness, you do have these specialized symptoms that you can look up in the repertory, which will lead you to the remedy. Now, if you look on extensions on page, let's turn to page 152. So these are some extensions. And if you look, head pain extending to the back, head pain bones. There's submodalities after headaches in the brain. And then on page 154, you can see sidedness. So you can see pain in the forehead, right side, pain in the forehead, left side. You can also see descriptors, boring, digging, screwing. So at first, when you are studying the repertory, it may seem like there's absolutely no logic at all. But when you begin to read these sections and you begin to see the certain format and how these symptoms evolve, then you'll become much more comfortable. So the only way to really become familiar with the repertory is to read the repertory, begin to use it, open it up, look up a symptom, and kind of go through the list. The generalities, the time, the extensions, all these things we talked about. Now, the mind includes both mental and emotional symptoms. We have a separate chapter on vertigo. The head includes sinuses here and meninges. We have a chapter on the eye and then vision, the ear, then hearing. The face includes the sinuses, the lips, the mouth, the mucous membranes, gums, tongue, palate, speech, and teeth. There's the throat, pharynx, tonsils, uvula. External throat is outside the neck. So it's important to differentiate the internal throat and the external throat. The back of the neck is in the back section, so there really is no particular section for the cervical area. You have to go to back. The stomach also includes food desires. In Kent's repertory, food desires are in the stomach section, but there are some more modern repertories where food desires are placed in the general. Then the abdomen. Rectum includes constipation and diarrhea. Stool is the quality of the stool, like color and consistency. We have the bladder, urinary tract symptoms, kidney, urethral colic. Then we have the prostate, urethral. Then we have a separate chapter on urine. We have a chapter on male genitalia, female genitalia. But many people feel that the female genitalia is way too small and it hasn't been properly repertized. Very few symptoms for pregnancy and menstrual problems. There's also a section on the larynx and trachea, qualities of speech and voice. We have a section on respiration, asthma, difficulty breathing, cough, expectoration, chest, pneumonia, and angina, back, cervical, dorsal, lumbar. It's broken up into different areas. There's a chapter on the extremities, the upper and lower, and then each upper and lower is then further divided into the shoulder, forearm, hands, fingers, etc., and the lower leg, foot, toes, ankles, etc. The sleep chapter contains the dream rubrics. So there are, in some repertories, there's a separate chapter on dream, but in Kent's, the sleep, the dream is a subcategory of the sleep. There's a chapter on chill, fever, perspiration, and skin. Now, one thing I'd like to emphasize is that there is a chapter on the generalities, and the generalities is an interesting chapter, and Kent and many homeopaths will put more weight on generalities than sometimes in specific. The generalities refer to the whole person rather than part of the person. So it's like, I am cold, I'm hot, I am an irritable person, instead of referring to a particular location. Like, I have head pain, my leg is restless, etc. So usually in homeopathy, when there's a general symptom referring to the whole person, that sometimes has a little bit more weight. Now, there's no listing for cardiovascular systems or neurological symptoms. And the book is not based on systems, it's based on symptoms. So, for example, dysmenorrhea may occur in many places, such as the female section or the abdominal section, and even in the mental section. So sometimes when you're studying the repertory, you have to know that you need to look in several different sections. Like, for example, eye pain, you can find that in the eye section, but you can also look in the head section and sometimes in the nose section. There can be some references to eye pain. Some pathological conditions are found in the generalities. Um, when you are studying the repertory, remember polycrests. These are the remedies that are well known and well established. They can be found in just about every rubric. So the danger is that when you select large rubrics with many different remedies, chances are you're going to hit one of the polycrests. So if you only choose large rubrics with greater than 100 remedies, you're not really going to find the similimum or the correct remedy. So when you do select remedies or symptoms, you need to further define and eliminate the large ones. So we'll talk more about that. So the mind section in the repertory is probably the most important and the largest section. And Hahnemann states in Aphorism 211, in all cases of disease to be cured, the patient's emotional state should be noted as one of the most preeminent symptoms. So as you continue your studies in homeopathy, I hope you're beginning to realize that we always look at many different aspects of the person. So, someone with a gastrointestinal problem, someone with diarrhea, someone with a particular symptom, the mental aspects are really critical, and that is going to be one of the most helpful things to help guide us to select a good homeopathic remedy. So, someone who with abdominal problems that is depressed will have a different remedy than someone with abdominal problems that are angry. So it is our goal to try to find as specifically as possible what are the key features of the physical problem and also be able to define the mental. So in every homeopathic case that I take, I always like to go to the mind section and try to find the best rubric that matches the patient. So let's talk a little bit about differentiation. And let's go to page 75. So I hope you have your Kent's Repertory with you. And sadness and mental depression. So we have a category here called sadness, mental depression. So what is the expression of the sadness? And we also have despair, and we have grief, we have morose, we have discouraged, inconsolable. So, sometimes when we detect that there's a certain sadness with the patient, we have to be able to differentiate the degree of sadness in order to then locate the remedy that is specific for this. So we do have a cross-reference to determine the degree. And in the repertory, we do have anger, irritability, rage, violence, quarrelsome, hatred, malicious, censorious. So these are all, subcategories under the mind that have a different degree, a different emphasis, and they have specific remedies that are characteristic. Anxiety and fear is another big category in the mental section. And we have to look at anguish, brooding. There's one, cares, worries, full of, in the repertory, thoughts tormenting, anxiety about health, guilt. So you're always better off not to just pick the broad category, such as mind, anxiety. If you do look at the rubric mind, anxiety, and let me find the page number for that. My goodness, in mind, anxiety, we probably have maybe 500 or 600 remedies. So you have to really define it by talking to the patient and trying to understand the characteristics of the anxiety to delineate it to a much smaller rubric to then kind of find a remedy selection that is more specific for the problem. So if you only select these really large rubrics, it's going to be difficult for you to be able to come up with the right remedy that is specific for the problem. There's another rubric called workaholism. And under that, there's work, desires for mental, industrious, busy, occupation, ameliorates. These are the different categories. There's also a rubric for envy and jealousy. Envy is usually about things or possession. Jealousy is usually about a person. There's a differentiation for shyness. There's timidity, confidence, one of confidence, irresolution, mildness, embarrassment. So all of these have some very, very subtle differentiation, and each one has different characteristic remedies. So, when somebody tells you that they're shy, you just have to know, you have to further define it in terms of these subcategories. Try to find out what is behind the shyness in order then to select a remedy which would be more specific for their problem. Paranoia is under suspicious and delusions persecuted. You'll find a section in the mind called delusions. And this section can be extremely valuable. It really doesn't mean that the person is a full-blown mental patient with a delusional state. Sometimes the way they're expressing themselves, sometimes in fears and dreams, you can find a particular rubric in that section. Stubborn is under the rubric mind obstinate or contrary. Speech is found in the mouth section, not in the mind. And sensitivity is also found in the mind section, oversensitive to particular qualities like music or noise. Reserved, you can find this under quiet disposition, introspection, secretive, talk, indisposed to, company, aversion to, and misanthropy. So the mind section is probably one of the most important sections in Kent. And in order to fully understand and appreciate it, the only way is just to begin to go through it, look at the different categories, and just look at some of the remedies that are in each one. High sex drive is found not only in the mind section, but it's found in the male section, sexual desire excessive, mind, libertinism, lewdness. It's also found under nymphomania for women. In alcoholism, it's found under mind alcoholism, mind dipsomania. It's also found under delirium tremens, mind mania apatu, and also under stomach desires alcohol. So once again, there are many sections of the repertory where you can find certain symptoms. Laziness, it can be found under indolence, work aversion to, fear of work mental aversion. Fastidious, it can be found under careful, cautious, conscientious about trifles. Rest cannot until things are in their proper place. So you can see that one of the drawbacks of the repertory is to understand the language of the repertory, the terminology that they use. So the purpose of this lecture is to give you an outline of some key mental conditions and where you can find them in the repertory. Under courageous, we have audacity, heedless, and cowardice is the opposite. Confusion of mind, we have many different subcategories of confusion of the mind. We have dullness, forgetfulness, memory weakness of, concentration difficult, stupefaction, and unconsciousness. Selfishness is found under egotism or haughtiness. Complaining, patients that are constantly complaining would be under lamenting or moaning. The repertory, you can use it more liberally, like, for example, in the dream section, delusion, delirium, fear. So there is an opportunity in your repertory for you to be kind of creative and the more you study the repertory, the more you appreciate how wonderful this book is. The book is about human nature, human emotions. So you can kind of extrapolate a lot of these things. If someone does behave in a certain manner in their real life or expresses certain symptoms, if that particular symptom is in the dream or delusion section, you can look at the remedies. So some homeopathic practitioners feel that there's really no difference between our dream state and our reality. So when we're looking at some of these remedies, we can go back and forth. So we have a question here. Veronica, did you have a question? Hello?
Yes, I do. And
Okay.
that's when you're. Hi, can you hear me?
Yep, I hear you fine.
Hello?
I hear you.
Okay. When you're reading the repertory, say like under confusion of mind, you have 3 or 4 different things,
What
and
page
you
are you? What
can't
page are
find
you on?
all 4. Oh,
Give me a
what
page
is
so we
this
can all
page?
follow you.
Page 7. Oh, I'm just looking at your slides.
Okay.
Okay, because I was looking at under confusion of mind. For instance, so say you have some dullness, weakness of memory, and concentration is difficult, and you can't find all of those under one remedy. How do you find which one of those is most important?
Well, there's kind of
Do you
an
understand what I mean?
there's kind of an overlap. So you said confusion of mind, and what was the other one?
Uh-huh.
You had
Well, confusion of mind, and under confusion of mind, say you have a dullness of mind, Um, forgetfulness and concentration is difficult.
Uh-huh. Okay, well, under those
Oh, I see what you're
subcategories, then you have to kind of determine, okay, the
Uh-huh.
confusion, what is the confusion that they're having? Are they forgetful? Is it just the general
Okay.
dullness? So you have to further define it. So confusion
And
is,
if it's more than one,
if it's more than one, then you can use more than one in your analysis.
so do you just find which, like, say, which one, if you can't find, say you have 2 or 3 in your analysis, and you can't find all those 3 under one remedy, how do you get to which one of those 3 is the most important
Well, by
so that you can look?
okay, by talking to the patient and by their expression.
Okay.
So, in other words, if they have confusion, but they're extremely forgetful, let's say that forgetful is the main
Uh-huh.
element of their confusion. So, you would rank that a number 3.
Okay.
That would be very high.
Okay.
Now, the way you rank a symptom by a 3 is it's very strong in the discussion, or they tell you that's the
Uh-huh.
main reason. So, like, say, for example, forgetful. And then let's say that they really don't mention the word dullness, but you're talking to them and do you feel like there's a certain dullness? And they go, yeah, well, that would be like a number
Uh-huh.
1 or a number 2. So then when you're looking up the
Okay.
remedies, the section on confusion forgetful would be a much higher ranking.
Okay.
So if the remedies don't
Okay.
match, then you would go with the forgetful. But it's much
Okay.
easier if you would try to define um, the symptom as best as you can. And of course, when you're just beginning homeopathy, these symptoms can be rather confusing, and you're not sure what particular rubric to select. So
Yeah.
always select the one that seems to be the highest with the patient. Um,
Okay.
so this idea of confusion, when you're analyzing it, you want to ask them questions. Well, tell me more about the confusion. What do you mean by confusion?
Uh-huh.
And if they go,
Okay.
it's just this dullness, or I'm confused with names, or I can't remember.
Uh-huh.
Tell me more. You want to get them to
Okay.
try to explain, because remember, which is really fascinating to me, that all of these symptoms were measured by provings. So, in other words, people actually took a
Uh-huh.
homeopathic remedy and they experienced confusion. So, when Samuel Hahnemann was analyzing confusion, he would try to get a better definition of what they meant by confusion. And this is how
Okay.
these things, because you're dealing with a description of certain feelings or mental states that sometimes people have a hard time putting into words. And
Uh-huh.
what you want to make certain is that you don't jump to conclusion by your interpretation. So let's say that
Yes.
you have a problem with confusion, and your problem with confusion is for numbers. So when you hear somebody say, I'm confused, you immediately think, oh, it's for numbers, when it may not be. It may be something completely different. So I hope that
Right.
answers your question, but you know,
It
you
does.
you kind of go what the person is emphasizing when you're taking their homeopathic
Right.
case or trying to understand, what is going on.
Okay, great. Thank you.
But don't be frustrated, because this is one of the most difficult aspects in homeopathy. is being able to observe the patient and being able to select the proper rubric. You need to select the proper rubrics and then find the right remedy. Okay, we have another question. Let's see, Miss Debbie.
Can you hear me?
Yep, you're unmuted.
Yes, can you hear me?
Yep, I hear you fine.
Can you hear me now?
I hear you.
Okay, so if talking about this same question, if we go to page 13 through 16 in the book, and it says mind, and then it says confusion, and you have a client who is saying forgetful, I'm not seeing how we find forgetful there. So, and I agree with you, this is the most difficult thing of what we have to learn with the course, is how to start in the very beginning to get on the right path.
Okay, well then
So
you would go...
Can we look? Page 13 through 16 is mind and then confusion.
Okay, but then there's on page 48, there's mind forgetful. There's actually a section on forgetful. So I think the question Veronica had is, you have a patient that has confusion, they're forgetful, and they have dullness. Which one do you select? Now what you do is, let's say they have confusion, and we have confusion on page 13. Okay? And then we also have forgetful on page 48. And then we also have dullness. Let me see where dullness is.
So when you go to confusion on page 13 through 16, it doesn't have forgetful there.
No, it's a separate rubric. We have dullness on page 37. So we have confusion on 13. We have dullness on page 37, and we have forgetful on 48. Now, when you're selecting these rubrics, you're not going to select them equally. Let's say you're talking to this person, and they have all three. But let's say you feel that forgetfulness is more prominent. You would grade that as a number 3. And maybe confusion and dullness are a number 1. Remember when we were doing cases? By every symptom, we had a number in parentheses, a number 1 or a number 2. So you would emphasize.
Just determining the number 1 for a beginner.
Right.
Determining the number 3 for the beginner, I think, is part of the more difficult challenge.
Well, number 3 is what's prominent. It's the first thing that comes out of their mouth. What trouble are you having? I have this dullness. I can't explain it. Everything is just so dull. And so that would be number 3. They're telling you that that's the most important problem. And then as you're talking to them, you say, are you forgetful? Yeah, a little bit. I do forget things. But that's something you put in their mind, so that's going to be less of a ranking. That'll be like a number 1. So you always listen to what the patient is telling you. So then what you do
is... So if you say, are you forgetful? I'm sorry.
Yep. So if you say, are you forgetful? And they go, yes, I am. That doesn't have a high rank.
What if they go... What if they go, if you say, are you forgetful? And they go, yes, I'm terrible at remembering. I'm horrible at being, at remembering things. But you put the sentence there, and they didn't say that first thing. Then how would you rank that?
It's not as high, because it's the power of suggestion. A patient, when a patient
That's what I thought. Okay.
When a person comes to you, they're trying to express what they're feeling to you to help them. And they're going to come with some symptoms. But if you start asking them questions, then a lot of times they want to please you, or they want to say the right answer, and they'll agree with you. And it's just a matter of, conversation or human nature. So it's always best to say, let's say they come in because they're forgetful. Tell me more about this forgetfulness. And if they go, well, this forgetfulness is kind of strange. It's more like confusion. See, they said it. You didn't. Ask them, are you confused? Or if they go, well,
I think the most difficult part for us.
If they go, well, this forgetfulness is it's strange. It's kind of like a dullness I have. Things are really dull. See, then they're bringing it up, and it has more value.
Yeah, I understand that. I think the most difficult part for a beginner, and I don't know if everyone else in the class agrees or disagrees, is if it's not written for you already in the book and you're trying to do the case yourself, is just determining which one is of most importance and then how to start the search in the book. Where to go to first. That's the most difficult part that I have found.
Well, hopefully by the end of today's lecture, you'll have a little bit more confidence as we go through cases. It'll be more helpful. But to be honest with you, even as a homeopathic doctor practicing for over 20 years, it's still difficult for me. If it was that easy, everybody would be doing it. But it's not impossible. And don't forget, now we are studying acute care in homeopathy. That's the best way to start. Acute care prescribing is the easiest way to start because you'll be able to select a remedy with the minimal amount of effort. When you're dealing with mental and emotional situations in constitutional prescribing, it's extremely difficult. But basically what you're doing is when you have an acute situation, you want to find out, what is the simple emotional state? Is there anxiety? Is there grief? Is there sadness or anger? Is there confusion or dullness? You want to find out one mental state that is linked to that acute situation. And then you find the best rubric and you look in that rubric and you find the remedies. Like, for example, confusion. Let's say that somebody had a really bad flu and they have a lot of confusion. You look in the rubric confusion, mind 13, and you look at the bold remedies. Belladonna is there. All right, I know belladonna. We studied that. And you go down the list and you see some of the bold remedies. The bold remedies are the ones that you should emphasize. Because in an acute situation, remember, if they're bold in the provings, they will be bold and prominent in your case. Does that make sense?
Yes. It's just going to the first place in the book I'm finding a little challenging to know where to start.
Uh-huh. Well, that should be easy because the patient will tell you where to go. He'll tell you the first place to look. I have diarrhea. What's your problem? I have diarrhea. First place you go is rectum diarrhea. All right? And I'm very confused.
Yeah.
Since I got this diarrhea, I'm confused. Mind confusion. The patient will tell you where to go.
Okay.
Or the person you're talking to.
All right, thank you.
Okay, good question. Good question. All right. So let's go on here. So anyway, first aid, acute and constitutional. These are the types of case analysis. We are studying right now first aid and acute, which is the best way to study homeopathy. Constitutional is extremely difficult because you have to look at the timeline of the disease. You have to go more into the mental and emotional nature. So I would not, for those of you that are taking this course, I would not jump into constitutional prescribing. Have fun with acute homeopathy and first aid. You'll learn the basics. And then later on, if you want to study in more detail, go into the first or constitutional. First aid cases don't take long to analyze. You look at the keynotes in the etiology. Keynotes are what are the peculiar aspects of what's going on in the etiology. Acute case taking. Read through the cases at least 3 times. Where is the center of gravity in the case? By we mean center of gravity, is it physical or emotional or mental? What is the chief complaint? What is the etiology? What is the main focus? Second time, look at issues or themes. generalities, issues to the central understanding of the case. So when you're reading a case or taking a case, you want to understand where is the center of gravity. So is it more of a physical problem? Is it more of an emotional, a nervous disorder? And always you want to know what is the chief complaint. I mean, they could present with diarrhea, but maybe the center of gravity is in this tremendous anxiety, and they're more concerned that they got an illness that's going to kill them. So even though they have one physical problem, the center of the case might be in the emotional. And you want to know what is the etiology. By that is, did they overeat? That would be an etiology. Did they drink some tainted water? Was there an emotional upset, a death or a trauma? So you want to try to understand, even in the acute case taking, what are all the things going on. And then once you understand all these issues, it's fun to put all these together. Look for strange, rare, and peculiar symptoms. And this is the fun part of homeopathy. SRP, strange, rare, and peculiar. These are something that just doesn't make sense. The biggest mistake that people have in acute case taking, they take common symptoms or general. For example, you have a flu. I'm tired. Well, everybody's weak and tired. And if you go into the repertory and you look under general weakness, there's probably 1,000 different remedies. But if they go, I have a lot of weakness in my legs, or, I'm just really weak in the morning. So you're becoming, you're starting to think in terms of a rubric. Look at choosing a rubric. You don't want to have too many rubrics. The fewer good rubrics that you have, the easier it is to get a remedy. So we always look at choosing between maybe 3 and 12 rubrics in a case. And the rubric should include a 3-legged stool if possible. So in other words, you have 3 really good rubrics, you'll have a stool that's not going to wobble. You have 4, 6, 7 rubrics, the stool is starting to wobble. This is probably the most important, and I have to underline this. After you repertorize and you find maybe 2 or 3 remedies that might fit the case, then you go to the Materia Medica and read about each remedy and see how it fits your case. So in other words, let's say you're studying a case with the flu, and you come up with belladonna, aconite, and gelsemium, and they're all listed there. You're not sure which one to take. Then you go to Boricke. Go to Boricke's Materia Medica and read about each one. Let's say the main problem is a sinus condition. So you read the nose section in belladonna and Boricke. You go to gelsemium and read the nose section. You go to aconite and read the nose section. And then when you're reading that section, something may resonate. And you may say, aha, that is the remedy that fits the best. Okay, let's see here. Okay, you want to avoid symptoms that are common for the particular pathology. So in other words, abdominal pain is such a broad rubric. Abdominal pain on the left side, better pressure is something that is a much more localizing rubric. Characteristics of the individual person. And this is often one of the most important aspects of selecting a remedy, because remember, in homeopathy, we prescribe for the person, not the disease. So, 5 or 6 people can get the flu, but each one is going to react differently. And that depends on their nature, the characteristic of the person. So we need to know how they're reacting, what is their mental and emotional state. That can be an additional leg of the stool. Sometimes the mental and general symptoms are more helpful than the physical. But, don't be upset if it isn't prominent, because sometimes you have an acute problem, an injury, sudden onset of diarrhea, sudden onset of the flu. There may not be a characteristic mental or general symptom, but if it is present, that is a valuable piece of information that's going to help you nail the right homeopathic remedy. So avoid symptoms that are common. You want to look at the characteristics of the individual person, how they react. Remember, prescribe for the person, not the disease. And the mental and general symptoms sometimes are more helpful than the physical. For those of you that may not be a little clear on the general symptoms are symptoms that the person usually describes. I'm upset, I'm hot, I am irritable, I can't sleep. They're general symptoms compared to, local symptoms. The right side of my belly hurts. I have a burning headache. So a burning headache would be a local symptom, but I am burning is a general symptom. So remember, the general symptoms are sometimes more helpful than the localizing physical. So in a urinary tract infection, pain in the bladder is a common symptom. And you're not going to find the remedy by repertizing pain in the bladder. There's just too many remedies. But pain that is better when the individual is taking a warm bath. So whenever you're interviewing a patient and you have to sort of interview in terms of rubrics in the materia or rubrics in the repertory. So what are the ways that Kent has categorized the repertory? Well, he has time modalities. So pain in the bladder, is there a particular time when the pain is worse? And if they go, yeah, it's kind of strange, it's like agonizing in the morning and the rest of the time, so that's a strong symptom. But if they go, well, I'm not really sure, it might be worse in the morning, that doesn't have much emphasis. And also, what makes the pain better or worse? And if they go, nothing really, then forget about that. But if they go, it's weird, when I'm taking a hot bath, the pain goes away, or when I put a lot of pressure on it. So now you got something. So migraine, all migraines have hid pain with vomiting. So that is not very useful. But if they go hid pain with vomiting and I got some twitching in my right eye, now you're on something. Anxiety is common. I'm anxious, I'm nervous. But if they tell you fear on waking because something might be under the bed, then all of a sudden you should have a smile on your face, because that could possibly lead you to a really good homeopathic remedy. Remember, the best rubrics are not too large. Head pain is too large or too small. The best size in general is 10 to 25 remedies listed in a rubric. We do have some rubrics that only have one remedy. You want to try to avoid those rubrics unless that rubric is precisely what you're dealing with, and that's a gift from the repertory. Remember, if you use the large rubrics, you end up with polycrests, and polycrests are the homeopathic remedies that I've studied rather exclusively, and there's many. And remember, the three-legged stool is most useful to have three really good rubrics that fit. And ideally, when you do the three-legged stool, you have one rubric for the physical, one rubric for the general, and one rubric for the emotional. So we cover not only three good rubrics, but we cover three particular problems. So an example would be, I am burning, I'm really hot. That's a general. I'm really burning, I'm really hot. And the specific would be, I have a throbbing headache on the left side. That would be the physical. And then maybe the mental or emotional. I have delusions that there's something underneath my bed. So that would be three legs of the stool. Confirming remedies. It is almost impossible for the symptoms of the medicine and those of the disease to cover one another as exactly as two triangles with equal sides and angles. In good case, however, this insignificant deviation is easily wiped away by the living organism's own energy. So, in other words, many beginning homeopathic students want to find that precise remedy that covers all the aspects very carefully. And you'll find when you do your case taking and analysis, something always doesn't fit, but you're always looking for those items that do fit. So it's almost impossible for the symptoms of the medicine and those of the disease to cover one another as exactly as two triangles with equal sides and angles. So in other words, when you get a remedy that's fairly close, you are going to help the person. So I don't want you to think that homeopathy is an extremely exact science. You have to precisely get the same remedy. If you don't, you're going to hurt the person. One of the joys of homeopathy is in many cases, if you get a remedy that's close, you're going to benefit the person. Read the Materia Medica on the most prominent remedies that come up in your repertorization. And sometimes you'll find a remedy in the Materia Medica that did not repertorize that fits your case. And sometimes you'll find that a remedy, even though it's in the top ones, it does not fit the case. So that I have to emphasize, that the repertorization is the first step. Try to find a couple of remedies that kind of fit the case, then open up your Boriki and read each remedy. This step has so much value because then you'll confirm the right remedy, and also you're going to expand your knowledge. You're going to be critically thinking about, is this the best remedy? Does this one sort of fit better? So don't put all of your weight on the repertorization. Don't put all your weight on the remedies that you select from Kent's repertory. More emphasis should be spent on Boriki's Materia Medica, reading about each remedy and understanding how that remedy manifests itself is the way you're going to be able to choose the right remedy, and also is the way you're going to be able to expand your knowledge of homeopathy. Constitutional analysis is much more complex. And in this case, you have to be more flexible in your approach. There's many methods for constitutional analysis. And, it's kind of like dancing. There's many, many ways you can dance. So the purpose of this course is not to teach constitutional analysis, but many times when you're doing acute prescribing, you will prescribe the constitutional remedy. And then not only will you treat that acute problem, but you'll have the joy in really seeing that individual become much, much better with the acute remedy. Methods of case taking. And these are all the different methods that have been studied over time. All of them have their positive features and all of them have their negative features. The essence is the central core feature of the person, match the remedy to the core. This is more often used in constitutional prescribing, where the essence of the person is matched. Every homeopathic remedy has a certain essence and nature, temperament, etc. And we look for that essence to match the remedy. Sensation and motion. Every remedy has certain sensations and movements. This is another aspect when we're dealing with looking at different kingdoms and miasms and ways of expression. But this is more for constitutional. The totality is the method that I'm emphasizing in this course. And this is particularly useful in acute case taking. And this includes the physical, mental, and emotional symptoms. This is where you get your laundry list of rubrics, laundry list of symptoms. You find the rubrics and you match the right remedy, the remedy that covers the majority of physical, mental, and emotional symptoms. And this is where the repertory comes in. Keynotes is another way of prescribing, and this can be an exciting way, a very good shortcut for selecting the right remedy. And as you study the remedies, you'll learn that there are certain prominent keynotes for every remedy. For example, when I took the belladonna, it's the fever at 3 a.m. craving lemonade. That's a keynote. Belladonna craves lemonade. Belladonna has this 3 a.m. fever. So, and of course, when you read the Materia Medica, Boy's Materia Medica, they list the keynotes of each remedy. So sometimes a prominent keynote will show up in your case taking and it makes it really easy. So there are the different methods of case taking. Strange, rare, and peculiar symptoms. This is something that you're looking for. The pathological approach is more of the allopathic approach. Certain remedies have more prominence for certain pathological conditions, but as a rule, I don't recommend that you take the pathological approach because you're not really learning homeopathy. Homeopathy is based on the symptom approach and the way the patient responds as an individual to that particular disease. Miasm, it helps the identification of the miasm to identify the remedy. And we talked about miasms in the first section. And miasm is a general category of the level of pathology. And there are three basic miasms: the psoric, psychotic, and syphilitic. Each has a certain expression. There are certain remedies that are more prominent for each of those. But the purpose of this course is not to teach the miasmatic approach. The family approach is that certain Homeopathic remedies have characteristic like the animals, the snakes are clairvoyant, suspicious. The compositae, which is a genus and species of a plant, is more into trauma and um, tough guy approach. Debbie, you have a question?
Yes, would it be possible, because this is what I'm finding most difficult, and maybe it's just me and nobody else, but could we do one rubrics together if there's time allowable, where we can do a case that's maybe more mental or emotional? Because, you know, the lemonade thing, that's real easy for me to get.
We're gonna go through that later. I'm gonna go through cases, and you'll have a chance to actually do the work. We're gonna do that this afternoon.
Good.
So we're gonna do.
Okay, thank you.
Okay. Okay, as I mentioned, there are kingdoms. We have animal, plant, mineral. There's a doctrine of signatures. So plants have a certain sensitivity. Animals are competitive, attractive. Mineral, structure, organization. So when you're differentiating your remedies, for example, if you have somebody with a cold or flu and they're very competitive, and they're into attraction, etc., then you would look at more animal remedies than mineral. So if you have somebody with a cold or flu and they're extremely sensitive, then you would look more for a plant remedy. So these are some guidelines, some different approaches to homeopathic selection. And this is just to make you aware that when you study homeopathy, there are many, many methods to help you select a homeopathic remedy. But the purpose of this course is more going to be on the totality of symptoms, uh, you know, selecting the right rubrics, trying to find a homeopathic remedy that fits the majority of these rubrics. Now, remedies are approved by the FDA. There's a book called the Homeopathic Pharmacopoeia, which all the remedies are listed, and that's required to be labeled indicating what they're used for. And they list the potency and the expiration date. Pellets are a form of taking the homeopathic remedy. These are put on their tongue and allowed them to dissolve. Sometimes children like them. They'll chew and swallow them because they're sugar pellets. Homeopathic remedies can be administered in liquid, and this is a certain number of drops under the tongue. LMs are a way of taking homeopathic remedy. This is dilution of 1 to 50,000. LMs are taken daily. In theory, any remedy can be used topically. Any homeopathic remedy could be applied to the skin. That's why it's important that you don't touch the remedy. If you're administering a homeopathic remedy, you should not touch the remedy because the energy of the remedy can be absorbed in your body, and also your energy can somehow affect and possibly neutralize the remedy. So avoid touching the remedy. When I administer the remedies, I'll put a few pellets in the cap of the bottle and then give it to the person. Just shake it inside their mouth. I like sometimes administering the remedy by a dropper. I'll have an eyedropper bottle, and I'll put a couple pellets in the bottle, let it dissolve, and then they can just take a dropper full once or twice a day as a homeopathic dosage. You can also put a few pellets in a glass of water and have them sip it. Nothing in the mouth 15 minutes before and after. This may be kind of strict. I think 5 minutes will probably be adequate. The main thing is you don't want to have a mouthful of food, mint, chocolate, candy, a cigarette. The mouth should be empty. The homeopathic remedy is immediately absorbed into the mucosa. You just don't want to have anything in the mouth or any residue in the mouth that could antidote the homeopathic remedy. Hands and free area from strong odors and contamination. This is something that if you do have strong vapors or chemicals, it can interfere. Never put the homeopathic remedy back into the bottle. So if you take out 20 or 30 pellets, you only want to use 3. Don't put the other ones back in the bottle. Throw them away. Sunlight and heat can inactivate the remedy. I think there's been studies to show that if the temperature gets up above 120 degrees, it can antidote and inactivate the remedy. This was a problem in Arizona. We actually had indicator tapes on all the homeopathic remedies. So if the temperature ever got above 120 degrees, the tape would turn from yellow to blue, and we would know. So the remedy should be stored in a cabinet or a refrigerator, at a low temperature, a constant temperature, and away from extremes. There is no shelf life. Homeopathic remedies last forever. In fact, Hahnemann's remedies that he used in the 1700s are still being used today. Remedies are available in solutions and alcohol, dissolved pellets in water, distilled water. Interestingly, a good way of taking a homeopathic remedy is olfaction, having them smell the homeopathic solution, taking a whiff of it. There's some doctors that actually inject the homeopathic remedy in acupuncture points or give it intravenously. Number of pellets. I believe that the number of pellets really aren't critical. Whether you take 1 pellet or 5 pellets, you're still getting the energy of the homeopathic remedy. Although in individuals that are sensitive, you don't want to have a large dose of taking a lot of pellets. It could overwhelm the body. But remember, we're talking about energy, not a physical substance. Okay, we have another question. Debbie, do you have a question? Hello?
Yes, the pellets that, can you hear me?
Yeah,
Hello?
I hear you.
Can you hear me? All right, the pellets that we got with the new kit, they're very, very small. And in the past, when I got the pellets through with boron, they were much larger. Are they the same size dose? Like if it says 3 pellets, would they be the same? Because in these new kits we got, they're so very tiny.
Okay, that's a good question. The kits that you got are 30C, and typically the X potency pellets are larger. So when you go to like a 6X pellet or a 10X pellet, they're much larger. So the higher the potency, the smaller the pellet. So when you go up to a 200 or an LM, they're very, very, very tiny. So the answer is it's the same number. So when we say 3 to 5, it's 3 to 5 of that particular pellet. Now I'm going to talk about antidoting. Antidoting is a full or nearly full relapse of symptoms. And this occurs within 24 to 48 hours of the inciting cause. The symptoms come back quickly in full force. And this is something we don't like to see in homeopathy. And that's why it's important that whenever you are giving a homeopathic remedy, you advise the person to avoid certain substances which might antidote the homeopathic remedy. Now, there are different theories on antidoting. Some homeopathic doctors feel that if the vital force or strength of the person is strong and you select the right remedy, the similamin, nothing is going to antidote. But on the other hand, if the person is weak, it's a poorly chosen remedy, and it's barely acting, then it's going to be susceptible to antidoting or neutralizing. Fortunately, antidoting is not that much of a problem in first aid and acute care. So what you're doing is you don't have to worry about antidoting. You can give a low potency daily or an LM potency daily. So you can repeat the remedy in the same potency, but it's important not to do this too soon. So in other words, the rule in homeopathy, I have to emphasize this, if you take a homeopathic remedy and it's helping you and the symptoms are getting better, do not take the second dose. So if you take a remedy and it's helping your symptoms and they're coming back, then repeat the remedy. Why are they coming back? Well, it is possible that maybe you antidoted it, you did something to affect the energy of the homeopathic remedy, or it is possible that the potency wasn't strong enough. The remedy wasn't strong enough to fight the disease problem. Whoop, let me just, what happened here? Okay. If you repeat too soon, you can cause a disruption. So what does that mean? Well, if you're taking the remedy too frequently, you can actually cause proving symptoms or a disruption. So that's a mistake that's often made in homeopathy. If you have a favorable response, do not repeat the remedy. If you keep on taking it, if you keep on taking the homeopathic remedy and eating it like candy, then you could have a proving symptom. Because remember, these remedies, if you take too much of a remedy, you could actually produce the same symptoms that you're trying to treat. As I mentioned, some individuals are more susceptible because of weak vital force. They're taking a lot of allopathic medicines, steroids, etc. The most vulnerable time to antidoting is within the first 3 months of treatment. But this is not an issue in acute prescribing. So this is, I'm talking about constitutional prescribing. When you're treating an acute case, you're going to see a response within a couple of hours. If you don't see a response in a couple of hours, then you got the wrong remedy. So relook at your case, take it again, choose a different remedy. As I mentioned, it's hard to antidote if it is the right remedy. So when you get to similimum and it's working in that person, it's tough to antidote. There's also mental and emotional reasons. So these are the big ones for antidoting. Coffee. Although it's interesting in India, when I studied homeopathy, they don't feel that coffee is a big source of antidoting. They even give the homeopathic remedy with coffee. Camphor, dental work. The high-speed drill has a certain vibration, and once again, I'm talking about this. These are things that are more critical with constitutional homeopathy, not with acute. Electric blankets, magnets, allopathic drugs, all these things. So simple thing is when you are treating an acute case and you're giving a homeopathic remedy, don't take any chances. So when you're giving a remedy for cold or flu or diarrhea, make sure that the person you're treating is not utilizing any of these, that they don't drink coffee, they don't take camphor oil, they don't run and get some dental work done until you can evaluate the effectiveness of the homeopathic remedy. Like I said, this is more of a problem in constitutional prescribing. I use LM potencies. LM potencies kind of eliminate the problem with antidoting simply because the person is instructed to take them every day. The LM is a different way of prescribing. It's a 1 to 50,000 dilution, which is meant to be taken every day, but you're not going to be using LMs in your acute prescribing. Supplemental or supplements are fine, like herbs, Bach, flower remedies are fine. Recreational drugs, cocaine, and other stimulants can antidote. Alcohol and marijuana, if used regularly, may or may not, in moderation, should not antidote. Tea tree oil is definitely a big cause of antidoting. Acupuncture, in most situations, will not antidote, but it can be. Body work, polarity therapy, massage is okay, chiropractic is okay. Oh, and I'd like to comment about microcurrent. I have found that microcurrent therapy will not antidote because we're using such a low current, it's usually not disruptive. Let's see. We have another question. Another question there, Debbie?
I have two questions. Can you hear me, Dr. K?
I hear you.
Yes, can you hear me?
Yep, I hear you.
Okay. Does the bioidentical hormones or the bioidentical thyroid antidote, number one, and number two, when you're trying to get the pellets out of this new beautiful kit we got, and let's say you tap it and shake it and you try to get 3 pellets out and then 7 come out and they go into the lid, but you haven't touched it in their lid, can those pellets go back in?
Okay.
I'm finding it difficult to get just the right amount of pellets out.
Bioidentical hormones should not be a cause of antidoting as long as the person is taking it on a regular basis. But if you prescribe a remedy and then they begin bioidentical hormones, that may be disrupted to the vital force. So if somebody is taking bioidentical hormones on a regular basis, it should not. If you're absolutely certain that you don't touch the pellets, you can put them back in the bottle. But generally speaking, I think it's much safer just to throw those pellets away because they are exposed to atmospheric vapors and things like that. How do you get 2 or 3 out? You just got to do it very carefully. And remember, the homeopathic medicines are cheap.
I wish they had the lid like boron.
Yeah, well, they don't. You just have to be careful taking that. Homeopathic remedies are cheap. It's just a couple of dollars to get a replacement vial. And I guarantee you that it's going to be years and years. I've been using my kit for 45 years and I still haven't run out of the homeopathic remedies. There's a lot of stuff in those containers. Okay, let's see. Veronica, I'm unmuting you. Veronica, you have a question?
Yeah, I have a question about the remedies that Debbie brought up. And that is that I know that like Hahnemann Labs, their homeopathic remedy, the pellets are bigger. And it's 3 to 5 pellets. And then like those little, the little from the Texas place, the kits that everybody got, those are really tiny. And it used to say on the bottle 10 to 20 of those. Does it really matter how many pellets you use?
No, it doesn't matter. You could use 1 pellet. 1 pellet is probably just as effective as 5 or 10. The only thing where you can get into a problem, in fact, when I was trained, we were taught to take the whole bottle. People were prescribed 1 vial, and they were instructed to take the whole vial. So remember, it's the energy we're dealing with. And 1 pellet has enough energy to be transferred into the person's body. I think the only reason why they say take 3 to 5 or 2 to 3 is you want to make certain that it goes in their mouth. If you only have 1 pellet and it's small, it's hard to see. And, you may put the pellet, may think it went into their mouth and actually fell on the floor. So when you have, 3 or 4, it goes in. The other way to do it is putting it in liquid. And that's a way that I sometimes like to do it because, when you have a person open up their mouth and you're trying to throw them in their mouth, their tongue may come up and hit the cap, or, you may accidentally hit their lips as you're putting it in. So one of my favorite ways is just taking 1 or 2 pellets, putting it in a small glass of water and having them drink it. Drink it slowly or sip it. That's actually my favorite way. And some doctors feel, homeopathic doctors feel that's the best way because you get more surface exposure.
Okay. And that's different than plussing it, for instance.
That's different than plussing it. Now, plussing it would be then you would, shake the water or mix it vigorously, to increase the energy. So that's
when
different.
you put the pellet in the water, you don't mix it vigorously.
You can mix it gently.
Let it
gently, but the thing is you want to avoid succussion. The succussion is what's increasing the energy.
Right.
So those are different ways. Okay, thank you. Okay, other remedies will often antidote. Um, Vaccinations cause a weakening of the vital force and will antidote. Stress, anything that you're extremely sensitive to might antidote. So if you do have some chemical sensitivities, allergies, things like that, that could possibly antidote. And I think that extremely sensitive people, individuals, they are the ones that probably are more prone to antidoting than the strong, robust people. So if you have somebody that is weak uh, and has a lot of chemical sensitivities, those are the people that you have to kind of, hold their hand and give them a lot more instructions on ways that they have to be careful not to antidote the remedy. And of course, if the antidoting does occur, then simply have them, repeat the remedy if you think they were antidoted. There are some particular remedies that are more susceptible to specific antidoting factors. Like, for example, Natrum muriaticum is more sensitive to mint. Sepia, homeopathic remedy sepia, is sensitive to vinegar or sour things. Let's see. Veronica, do you have another question? Or did you forget to put your hand on? Oh, no question there. Okay.
I'm sorry, I forgot to put my.
All right. Okay. Potency means power or strength. So a homeopathic potency is a potentiality. When we potentize a medicine, it becomes more of what it truly is. So a low potency is considered 30C or below. Medium refers to 200C, 200X or 1M. High refers to 10M or above. Now, the whole discussion and debate is, when do we need a high potency? Is a high potency better than a low potency? My experience is that it's much more important to select the right homeopathic remedy than to worry about the potency. So, in other words, if you have the right remedy selected, whether it's a 12C, a 30C, or a 200, you're going to get a beneficial effect. Sometimes, if you have a very severe acute illness and you need, and then the lower potency doesn't work effectively, then you have to go up to a higher potency. Unfortunately, some pharmaceutical companies, homeopathic companies, will not give a 200C or 1M to an individual who does not have a medical license. So it may be tough for a lot of you that don't have a medical license to get a 200C or 1M. I would feel your hands are not tied. I know many, many really good homeopathic doctors who do this for a living who never go higher than the 30C. So I don't want you to feel like you're handicapped if you don't give a 200C or a 1M or higher. I think a 30C is a really, really good potency that's going to handle most of your situations that you come across. In fact, this disagreement with potency has been a time-long disagreement, even at the time of Hahnemann. This really tore the homeopathic profession apart. The battle between the low potency prescribers and the high potency prescribers. And it's interesting, the low potency looked at the world more in a material way, and the higher potency looked at it in a more spiritual. So the higher potencies were felt to be of a more spiritual healing than the low. I like the 30C because it's kind of between the high and the low. So I think when you use a 30C, you get the best of both worlds. And as I mentioned, selecting the right remedy is far more important than selecting the right potency. So the selecting of the right potency is based on the clarity of the case, the strength of the vital force, and the low and the slow. So a case that's very clear, the person has a strong vital force, then we can go with a higher remedy. Now, in terms of duration of action, and this is just a rough guideline, and the way I like to look at it, an active disease kind of eats up the homeopathic remedy. So if you have an active flu going on that's burning and smoldering and the viruses are there, then maybe a 30C it's not going to last a month. It may last a couple of hours and you have to repeat it. So this duration of action is just kind of a guideline. So a 12C lasts for a few days, a 30C a month, a 200C 6 to 9 months. And I think this is referred to more in a constitutional prescribing in terms of this duration. So you can throw out these rules when you're looking at homeopathic remedies in an acute situation. So finding the similimum potency is what we all are looking for. So not only do we try to look for the similimum of the remedy, but the similimum potency. So the other problem is high potency causes more aggravation. And sometimes even the strength of the succussion. So the pharmacies that use more force in preparing the remedies in terms of striking it. Remember we talked about roughly there's 10 succussions between each potency. So from a 1x to a 2x, there's 10 shakings that if you use more force, that's going to have more potency. Some considerations. Usually if you're treating a skin problem, you like to use lower potencies. Why? Because the higher potencies will cause a greater aggravation. People that are extremely hypersensitive, you want to use a lower potency. And I know that individuals sometimes that I treat that have a lot of chemical sensitivities and just have a sensitive nature, I first ask them to hold the homeopathic remedy. Don't even open the bottle. And then the second step would be to open the bottle and let that energy just come close to their body. And then the third stage would be just have them gently smell. So these are extremely sensitive individuals. And it's always better to be on the cautious side when administering a homeopathic remedy. So when you do have those hypersensitive individuals, go with a really low potency. Just have them hold the bottle, smell the homeopathic remedy, be very, very gentle. When they're taking allopathic medications, you can repeat the remedy more frequently because allopathic medicines kind of eat up the homeopathic remedies. When there is lack of clarity, and what do I mean by that? If the homeopathic symptoms and the remedy is not that clear, you're much better off with a lower potency. You don't want to go really high when you don't have a really clear case. By clear case, good rubrics that point to one particular remedy. Generally speaking, the elderly, because they have a weak vital force, you want to use a lower potency. Remember, if you have a strong, healthy vital force, higher potencies will do better. So when you have a child or a young person that hasn't had a lot of suppression, a good, healthy vital force, you can go with a higher remedy. So be cautious about repeating too frequently or in too high potencies. You're much better off in giving a homeopathic remedy and waiting I think that's the biggest mistake with a lot of people who are prescribing. They like to repeat the remedy too quickly, and patients or people that you're treating like to take the remedy. If it helps, they want to take a second dose and a third dose, and it may not be necessary. And you can develop proving symptoms. You can actually produce the symptoms that you're trying to cure. But it's rare to develop proving symptoms in acute care. So in other words, if you're treating that high belladonna fever, don't be worried about repeating the remedy. Let's say you give the remedy and you're not sure if it has helped the fever, or maybe it's helped the fever, but you think the fever is coming back. Don't hesitate to give the remedy again. It's hard to develop proving symptoms in acute care. So the patients that you're going to be treating for acute problems, don't be afraid to repeat the remedy. Now, a good technique is called plussing. And you take a few tablets of the remedy and you put it in 4 ounces of water and you vigorously shake it 30 times and then take 1 teaspoon. So by plussing, by shaking it, you increase the potency of the homeopathic remedy. And you can do this again. So let's say you have a cup and you put the remedy in, you shake it, and then you take 1 teaspoon. If you shake it again, that's going to be a much higher potency. And also, if you put more water in the cup, you're diluting it. And when you're diluting the homeopathic remedy, you're increasing the potency also, and by shaking it. So you can do this in succession to make a stronger remedy. So there's 2 ways to increase the potency. One is to shake the same remedy more vigorously. That'll increase the potency. The second way is to dilute it more, and you'll increase the potency. LMs are designed to minimize the risk of aggravation. I like LMs because most of the patients that I treat are elderly. They're taking pharmaceutical medicines. They have a weaker vital force. But LMs are meant to be used by more experienced prescribers, and LMs can be used for acute conditions, but they're much better for constitutional treatments. So I would not recommend any of you using LMs unless you go on to study homeopathy in more depth or go on to constitutional prescribing. I think the 30C is a very good way to start. Okay, what we're going to do now is take a break. If any of you have any questions on what we covered on potency so far, we're going to take a break right now. And what I'm going to do is I'm going to sign offline. So all of you will have to sign up again at 1 o'clock. So if there's no other questions, we're going to take an hour break, and I'll be back at 1 o'clock. So any questions? Oh, okay, we have Debbie here has a question. Miss Debbie?
Doctor, when you say mix, yes, can you hear me?
Yep, I hear you.
Can you hear me? Can you hear me?
Yes, I hear you.
All right. When you say take some pellets and put it in, when you say take pellets and put it in the distilled water, isn't it supposed to go into the dark glass and then not touch a metal teaspoon?
No, you can put that in any glass. It can touch a metal teaspoon. It's not going to interfere with the remedy. So you put the pellets in a glass.
Okay, I thought it needed to be in glass always.
No, it could be a plastic. Well, we know plastic isn't good for you to drink out of, but for a short period of time, it's not going to matter. You can put it in black glass. You can put it in metal. It's not going to be a problem. Mix it.
So it's only if you stored it that you would. It's only if you stored it that you would need to put it into dark colored glass then?
Right. If you're storing it, I would not store it in metal. I would store it in
Or clear glass.
or clear glass. Well, you can store it in clear glass if it's in a dark location in your home. You want to avoid sunlight. It's the sunlight that can antidote. I don't think natural light will antidote a homeopathic remedy.
Okay, thank you.
Okay, and Regina, do you have a question? Hello, Regina.
Yes.
Yeah, do you have a question?
Hello?
Yeah, I hear you, Regina. Tell me your question. Hello?
Okay. Yeah, I would like to know about the pH of the water. Because usually they say to put in a, how is it?
A neutral pH?
That is not alkaline.
No, when you're dealing with a homeopathic
what is
remedy,
the reason?
No. When you're dealing with a homeopathic remedy, pH doesn't matter.
For diluting.
No, it doesn't matter. You can have any pH water.
Oh, really?
Obviously, you're not going to have real acidic water or real alkaline water, but any type of water. And remember, we're looking at the ideal water would be distilled water. But it's not essential to have distilled water. Tap water will work fine in terms of deleting this. Or diluting.
Yeah, because you... Because what...
Okay, then Sue had a question. Essential oils. You have to be careful with essential oils because some essential oils can antidote a homeopathic remedy. So that's a good question. And let's see. And there was also a question about constitutional analysis. Will I be teaching a course on constitutional analysis? And that is something that I would like to do. Unfortunately, a course on constitutional analysis is best not taught via the webinar. So I'm thinking about having a program at the Florida Wellness Center where people can get together and we can meet for a long weekend and go over case taking and things like that. But the constitutional course would be really difficult to teach via the webinar because you need much more interactions and hands-on work with students. Okay, so we are going to take a break. I'm going to sign off. So at 1 p.m., you'll have to sign back on to the webinar. Okay, thanks everybody, and I'll see you later.